Health officials are looking to put a cap on exorbitant overtime pay for public service nurses. Health Minister Dr. Dwayne Sands says the Public Hospitals Authority continues to negotiate with nurses. He says there's no impasse, but concedes that the $750,000 monthly overtime bill is exorbitant. Jimenita Swain has the story.
Just Friday, President of the Bahamas Nurses Union, Amancio Williams, suggested that there is an impasse in negotiations, but Health Minister Dr. the Honorable Dwayne Sands suggests otherwise as negotiations over a new standardized shift system resume between the union and the Public Hospitals Authority. Against the backdrop of nurses' shortage at the Princess Margaret Hospital, Williams suggested that the bone of contention remains overtime pay, and so does the health minister.
This vexing issue of the shift system gets at the very heart of the challenge that the PHA had a $750,000 overtime bill for 1 month, and that is not sustainable.
The PHA issued a statement Tuesday saying that it is willing to re-engage in negotiations with the BNU over the shift system it introduced late last year before it was put on hold indefinitely. Meantime, the authority has proposed a shift premium for nurses scheduled to work between 6 p.m. and 6 a.m. of $1.75 per hour. The union has asked for at least $3. PHA maintains that the successful implementation of the new shift system would establish a standardized 8-hour daily shift, improve on the delivery of health care, reduce the number of accidents, and eliminate current inequalities of the current night shift. The health minister notes that officials have been working to address a number of concerns at PMH.
Changing out the beds at the hospital is a major issue because of the problems with movement, back injuries, and so on and so forth. Looking at safety, looking at being able to clock in. Nurses complain that sometimes when they clock in, they have to wait for 10 or 15 minutes. We're about to install more than 10 new stations to make that a little bit easier.
The health minister says that they will work to retain nurses despite the challenges they continue to encounter.
Bahamian nurses are being pulled away from the public sector in the Bahamas into the private sector in the Bahamas. That's true for dialysis, for instance. It is not so simple to say, well, just change the pay structure, because the pay structure in the civil service or in the public sector is tied to physicians, to teachers, to policemen, to firemen, to other civil servants.
And Dr. Sands says health officials are prepared to find a solution with nurses as long as all parties are prepared to work together. Jimenita Swain, ZNS Network News.